So many people have sciatic nerve inflammation, tingles and numbness down their legs, restless leg syndrome because of it. Their butt hurts so bad, their back hurts, lower back, their legs hurt, goes down the piriformis, gluteal nerve, all of it, everything gets inflamed. Those sciatic nerves, when they get inflamed, the inflammation hurts so bad from some people they can't stand on one side. They can only walk on another side. But yet if you don't move your legs and use them, it gets worse. But yet you can't sit down and then you got to lay down. So difficult. We'll talk about that. When those sciatic nerves get inflamed, they send signals down all the way down to your feet. You could have a pain in your foot. And it's a really bad pain where you can't even touch it, and it's coming from your lower back. So many people suffer from the sciatic nerve inflammation caused by the shingles virus as being one of the causes that gets these nerves inflamed and gets people in trouble. Let's head to the sciatic nerve pain now. What shingles viruses like to do, and Epstein-Barr can play a role too if there's enough neurotoxins floating around from EBV, but the shingles virus is the most common for this. What happens is when the shingles virus gets onto the nerves, the sciatic nerve, when it's frayed, that's when you get the sciatic nerve pain in many cases. So even for people who don't have some type of real injury in the back, but they have sciatic nerve pain all the time because the shingles virus got onto the nerves that were frayed. So what does that mean? Sciatic nerve can get frayed like yarn. So you see those little tiny root hairs on yarn, and those little root hairs stick out. Virus tends to cling to those root hairs, and then when it clings to the root hairs, it aggravates the nerve. It's like having something on your nerve that shouldn't be there. And in that case, the nerve then gets inflamed and starts to swell. And then you can have pain anywhere, not just in the lower back, in your groin. You can have it on your butt, you can have it on your leg, you can have it on your thigh, you can have it on your calf, all the way down to your foot. A shingles bug, that's the sciatic nerve bug right there. That's the one right there. Herpes simplex 2, herpes simplex 1 and 2. So herpes simplex can also affect the sciatic nerve, but shingles is the big one. That's the big one. So the shingles virus grabs onto root hairs that fray off of that sciatic nerve, off of that tibial nerve, off of the lumbar nerves. So we get these, so if you get a pinched nerve, even if it's slightly pinched, you go to your chiropractor and like, well, I got a pinched nerve, my chiropractor says, he says my nerves are pinched. That means that what happens is these frayed, little tiny frayed root hairs come off the nerve. These little root hairs, they come off the nerve. And then if your immune system's low, and everybody has shingles viruses in them. They catch them everywhere, from public bathrooms, from relationships, from restaurants, eating in restaurants. You get the shingles virus, it's in your system, and it's sitting in your liver, and it's dormant. So people don't realize it, but the shingles virus is in everybody's liver. Some people have 1 or 2 varieties. Some people have 3 varieties of shingles. They also have the Epstein-Barr inside the liver, right? What happens is as our immune system lowers, okay, the virus can then crank up and proliferate. When it proliferates, it goes and it literally has a homing signal to look for frayed root hairs. When it finds a frayed root hair, it clings to that frayed root hair and it holds on to that frayed root hair. And then that's when it bites. And that's when you're being bit. You're being bit by the bug. And that bug is grabbing on to that nerve. And when that bug grabs onto the nerve, and now you're inflamed. And now, if you have a ruptured disc, if you have a bulging disc, protruding disc, or if you have a pinched nerve already in there, it's going to be amplified by 100.